If you're like a lot of people, you probably experience pain in your neck, shoulders, and upper back. And if you're like many of them, this pain has been with you for a while and it just does not seem to go away. Maybe you've tried a few stretches, gotten a massage, popped some anti-inflammatories, but nothing has ever really fixed it. Now, if this sounds like you, you're in luck. In this video, I'm gonna show you exactly how to fix this pain once and for all. Hi, I'm Dr. Charlie Oliver, a chiropractor and physical therapist practicing in San Antonio, Texas, where I combine the best of both professions to help people just like you live pain-free. On this channel, we are all about practical solutions for your pain, so let's dive into today's topic. The first thing we need to do is figure out where your pain's really coming from. Your neck, your upper back, or your shoulders. Believe it or not, a lot of people confuse neck pain with shoulder pain and vice versa. So let's get started. Where exactly is your pain? Neck pain usually runs down the back or the sides of your neck, but rarely affects the front. If you're getting pain or a problem in the front of the neck, that's really not an issue for a chiropractor. That's more something for a medical doctor. Now, interestingly, neck pain can also cause upper back pain. A herniated disc in the lower neck can even send pain down into the shoulder blade and then go down the arm from there. Upper back pain just below the neck often stems from the neck itself, but if it's lower, like around the bra strap or what we would call the T4 level, that's usually coming from the mid back. And a lot of times, because that part of the spine is responsible for rotation, you might notice increased pain or tension when you twist your trunk side to side. Shoulder pain though, typically appears on the side of the shoulder and worsens with arm movement. So pain in the upper trapso, that's usually coming from the neck or even the upper rib cage. Now, pain in the front of the shoulder could be from the biceps tendon or even the AC joint, which worsens when you move your arm across your body or behind the back. Now let's talk about fixing it. The most common muscle pain generators in the neck are the suboccipital muscles, the upper traps, and the rhomboids. Now, if you push into those areas and they hurt, you found your pain source. Now, once you find those tender spots, you can start working on them. You can dig in with your fingers, use a trigger point tool, or even a massage gun. I would suggest against using the massage gun directly on the neck though. Otherwise, if you're just plain digging into tight muscles, you really cannot hurt yourself. A lot of people come to see me after they've already tried these tools, and that's great, and I encourage you to keep at it. Remember, chronic pain doesn't just go away overnight. It takes time to retrain your brain to totally release that tension. Now, moving on to the mid-back, most of the pain here is caused by muscles along the spine, from the shoulder blades down to the upper low back. People love using foam rollers and lacrosse balls for this area, but let me tell you, they rarely fix a problem by themselves. Here's a little secret though. Sometimes the tightness in your mid-back is actually connected to tension below the rib cage, possibly from the diaphragm. If you have a foam roller, try even lying on your stomach and rolling that area out. You'd be surprised at how much it helps. And I say this from experience. When people come to see me and they have pain in the mid-back, I can adjust that area. I might mobilize it. I might dig in as much as I can on the muscles. And sometimes we get limited results. And then all of a sudden, I start poking and prodding through this connective tissue here, which again is kind of in the vicinity of the diaphragm. And a lot of times it creates a miraculous change for that pain in between the shoulder blades. So if you have a foam roller, try lying on your stomach and rolling that area out. You might be surprised at how much it helps. For shoulder pain, grab a lacrosse ball and dig into the muscles on the back of the shoulder blade. You'll find several really tender points back there. Next, I want you to dig into the supraspinatus. This is a muscle on top of the shoulder, and it's where the collarbone meets up with the shoulder blade, and there's kind of like a V shape, and you'll find that muscle deep inside there, and it will hurt. But again, you can dig in there. You're not going to cause yourself any damage. Then the last part to hit on that muscle goes under a bone right here, and it inserts into the humerus, the long bone of the arm. Again, you'll find a really tender spot there and just work on digging in right in there. Also, don't forget to work on the subscapularis, which is a hidden gem. It's located on the front of the shoulder blade, so it's inside the armpit, and it's a huge pain generator. In fact, it can cause pain down into the side of the arm, even down the arm, and most people don't even know it's there. Now, let's talk about the bigger picture, posture. You can stretch, massage, and strengthen all you want, but if your posture is off, nothing is going to work in the long term. Slouching throws your head forward, it strains your neck muscles, it compresses the discs in your neck and in your mid-back, and it it even rolls your shoulder blades forward. This messes with everything and makes you more prone to injuries like rotator cuff tears. The easiest thing you can do to improve your posture is to spend less time sitting. So sitting is a spine killer. So whenever possible, lie on your stomach while you're at home on your phone or on your computer. And if you're watching TV, just lie on your side. Now, if you have to sit, and obviously we all do, my best advice is don't try to just sit up tall and maintain that. No one, including myself, can do that for very long. The best strategy really is to do things to essentially make it easier to sit up straight by increasing the arch in the low back. So that could be with a lumbar cushion or lumbar roll in the low back. That will automatically increase the arch down low, and that will bring your head and your shoulders backwards so you don't have to think about it. Another great tip there is if you can raise up the height of your seat so that essentially you're bringing your hips up higher than your knees, that's going to also roll the pelvis forward. Kind of like if you sat on a bar stool, how it's easy once you're sitting up tall, it's easy to sit up straight. Same concept there. But once you do that, and if you can sit there in that position as opposed to standard being slouched over, that is going to take a tremendous amount of stress off of your spine and your shoulders. Now, before you set out to try to fix yourself, keep in mind that the longer you've had the pain will dictate how long it'll take to get lasting relief. It will take time and repetition. Now, if these solutions do not get you pain-free, now it's time to seek professional help. Your first stop should be to see a corrective chiropractor who can take x-rays to assess your posture and guide you through a thorough treatment plan designed to realign your spine, just like braces do for teeth. If you found this video helpful, hit that like button and subscribe to the channel for more videos to help you live a pain-free life. As always, thanks for watching, and I'll see you in the next video. Have a wonderful day.